Hi, I'm Cynthia West. I'm with Healthy and Equitable Communities. We're part of the State of Alaska Division of Public Health. We have program coordinators located across the state that are here to support public health, health and wellness and equity in our communities. And I'm leading our team on childcare solutions and wanted to share a few of the really cool things that we are up to today. Next slide. And I'll see if I can't do this really quick. So the goal of our childcare work is really simple, and we are accomplishing this in 3 simple steps. We are supporting existing childcare providers by fostering relationships, facilitating network opportunities, and organizing provider appreciation events in collaboration with the Child Care Program Office and Thread Alaska. This approach enables us to better understand and address individual challenges and barriers that they face and really make a difference. Sometimes it's just one-on-one, sometimes it's community-wide. Really exciting work. We are fostering new startups through community-designed events and one-on-one support. We've been in a number of communities already. We just finished up in Cordova, which is an absolutely amazing community. We take a new approach or different approach depending on what community we are in. And we are creating unique local and statewide partnerships to develop childcare solutions that fit each community. Next slide. In May of 2022, so here's some numbers for the Southern Kenai Peninsula. When I started this work, we were at 56 licensed childcare spots available on the Southern Kenai Peninsula. This included 2 home childcare businesses and 1 childcare center that was operating at less than 50% capacity. These are the folks that managed to survive COVID. They were all located in Homer. Through traditional marketing approaches such as flyers, emails, and phone calls, we didn't have any luck with internet, Facebook, job service, but we were able to recruit the necessary employees for our child care center to return to full capacity. The center is interested in expanding, but she needs a suitable location. And surprisingly, we were able to reach a lot of folks through local churches that were interested in stepping up and working part-time or full-time in childcare, even though the wages are so low. And please note that these numbers exclude programs operating under recreational waivers, relative providers, home providers caring for 4 or fewer unrelated children. Currently, though, our numbers have decreased due to the closure of the Soldotna preschool, attributed to no staff, and we also have 1 provider in Homer home business that is closing so that she can take care of a child with special needs, which is a desperate need that we have across Alaska. It's for those kiddos. Looking ahead, we are excited about opportunities to expand our child care capacity. I think by next summer, we can have at least 100 more spots, thanks to the hard work of our South Peninsula Hospital. Derotha can speak a little bit about that to you as well. And we have a local church that is currently fundraising to break ground soon and open next spring, child care center as well. Next slide, please. 2 of the biggest barriers that we're seeing statewide are living wages and adequate locations for new childcare centers. So what can you do to support childcare? Do you have a space for a childcare business to operate or at a reduced or no cost rate? Can you provide a monthly stipend that a childcare center can count on for higher wages in exchange for guaranteed numbers of spots for your employees' children? Can you advocate for safe, high-quality, licensed childcare as critical infrastructure, not just a social service? That is a huge barrier that we're still working on. Can you open your own childcare business, or can a childcare center be part of your business, offering staff living wages and benefits as actually being employees of your business? If any of these fit or you'd like to talk more, we'd love to chat about it. I have Raquel, who lives and works in this area, here with me, so come find us. We'd love to chat a little bit more. Next slide. And I'm going to go over this really quickly for you, but we have a couple of really cool programs that we're working on as well that are going to affect folks statewide. So with adult ed, we are working with Michelle and Homer to design a free statewide childcare prep program. This aligns with the work we're doing alongside public health case managers to empower parents to become self-sufficient by helping to develop essential skills needed to become child care providers. This will assist anyone caring for children. We hope to see 2 semesters. The first semester will be designed for those basic prep skills, and the second semester, depending on the student's interest, may involve one-on-one support to get them licensed, get them opened as child care providers. And this will be statewide. We're starting small with about 20 students. And then next slide. Okay, really fast. So I am over the moon excited about what the University of Alaska Anchorage Department of Education is doing around childcare. So in addition to their other 2 programs they've had, they are now also doing an occupational endorsement in infant and toddler development. That is a 2-semester program that meets the child care administrator requirements for licensing and does not require a GED or diploma. Through a partnership with the Child Care Program Office, UAA Ed is also offering an occupational endorsement, and this won't show up on their catalog because we didn't get it done quick enough, but it's an occupational endorsement for starting and running a child care business beginning this fall, and a scholarship for these classes. So if you're counting, that was 5 barriers. Please reach out to UAA if you have any questions, and thank them for their dedication to healthier communities in our state. And last slide. So this is Raquel and my contact information. We would really love to chat with you about the work that we're doing in a number of areas, how you can support childcare, and how we can support you. Thank you for your time.
Thank you. Good afternoon, everybody. I'm Derotha Ferraro, the Director of Marketing, Public Relations, Communication for South Peninsula Hospital in Homer, Alaska. Thanks for the invite to present today. I can't quite see the screen very well, so Michelle, when something's showing up. It doesn't look like South Peninsula Hospital. Will you go to the next slide, please? Thank you. That's South Peninsula Hospital. All right, great. So welcome to SPH. So we are a community hospital. We're owned by the borough and then contracted to South Peninsula Hospital Incorporated, the nonprofit. That's who I work for. So borough owned and then nonprofit operated. We have about 620, 630 employees, and we are a traditional hospital services, but also a nursing home, home health. We own 2 primary care, run 2 primary care offices, just really certainly the largest provider of health services in the community and the largest single employer for the southern Kenai Peninsula. Our service area comes up to Ninilchik, goes down and out to the head of the bay. So that's just a little bit about South Peninsula Hospital. The commitment that we make with the borough when we sign the sublease and operating agreement as the nonprofit is that we will run a hospital for the borough. And the number one thing that we need to do is competent staff. And without staff, the doors close. There's other things too, revenue. I mean, there's all kinds of other things, but you can't do any of that. You can't generate revenue. You can't do any of the services without staff. And today I'm going to tell you a little journey about a problem we had in keeping staff. Next slide, please. We, for at least 6 years, have had a committee at the hospital who would meet after work and complain that they don't have childcare. And we were doing Band-Aids. We were creating little, did it move? Oh, it's the wrong. So while we're pulling up the other one, so the committee would meet. We came up with little Band-Aid fixes, things like private Facebook group for staff to be able to say, oh my gosh, my babysitter canceled. Oh, my kid's sick and can't go to childcare. Can somebody help? And those types of things. We even created a system where the hospital was paying to reserve spots at a local childcare license. Are we there? Okay. Yep. Okay, great. Thank you. So the employees were working on their own to solve the problem. And at every meeting at the end, everybody would say, the hospital really needs to open a childcare. The hospital really needs to open a childcare. Some of the demand for it really resulted in employee resignations. Employees would just get to the point where they were band-aiding their own personal childcare together in a way that was too stressful. They were calling off work, which was then creating stress shifts for the people that were there. And we saw many resignations that in the exit interview, I just couldn't find reliable, affordable childcare. Next slide, please. So we were super lucky that we had years of committee meetings behind us when THREAD announced a $15 million grant program funded by the American Rescue Plan and the Coronavirus Response Plan to address the child care capacity problem in Alaska. And they announced that last spring, and we were able to scramble to get an application out the door. But I will tell you that we had a strong application because we had been participating in the local coalition that Cynthia was running and pulling all of the child care related people together in the community. So we'd been attending those meetings. We had data. So our local Economic Development Commission had done surveys over the years. Our city had an economic development plan that had documented priorities. Our community health needs assessment showed the need. So we had volumes of data that we could put in the application. And the third thing that made it strong was partnerships. We partnered in the grant application with the high school to develop a volunteer training program that would then be a feeder pipeline for the child care center. We're partnering with the university to offer some of those classes locally right at our campus. So right in our application was commitments from those local education units to be partners to help with the sustainability of a child care center. So we put our application in. There were 68 applications, and we were lucky to be awarded. One other partner was in the application was a business partner from right here in Soldotna, a very successful child care business here. Was able to work with our CFO to come up with some of the business plan aspects of the grant application with all of the formulas and numbers for staffing and the costs related. So we did, we were awarded a $1.3 million grant, and the breakdown for how we plan to spend that there. One thing that might not make sense to you, cost of renovations to move our existing services out of the building that we were going to put it in. And we were happily surprised that the grantors agreed to give us some monies to renovate other spaces to vacate the area to create the childcare. Next slide. I just want to show we did lots of community or employee surveys over the years, and the most recent one, we had 70. The most recent survey of employees resulted in 77 children that were going to need childcare this coming summer. That they would definitely use a hospital-based childcare program if we had it. So definitely the demand was there. However, our goal with the grant is that we're simply adding capacity. So even if somebody takes their child out of a local childcare program, that's freeing up a spot for somebody else in the community. So we're not, as a result of us doing this, nobody's going to close. It's just, the rising tide floats all boats. It's definitely going to just help build capacity in the community because this will be a hospital employee only. Childcare. Next slide, please. So the early childhood education workforce crisis is documented on this slide, and you see the blue line is specifically childcare workers. So not your teachers or your administrators, but just your workers. And look at the decline during the pandemic, basically. I mean, it really, really went down. Those were some of the really worst jobs really that we saw during the pandemic, just everything they had to deal with. Our goal is to use grant funding to add to our trained workforce. We added enough in our application to pay for people to attend classes, although we're hearing some of them are actually free now or they're scholarships, but we put in the grant application the monies that would be needed. So if we just needed to hire a whole, greenhorn crew and pay for a month or two to have them go to Anchorage, go online and get all the certifications that they needed, that would be great. And it would be adding to the local workforce in the community. Next slide. The childcare will not be free. The grant simply gets it going. It creates it, gets it up and running, and then employees will pay market rate for it. The blue boxes show basically what our guesstimates are. We're still finalizing it, but the average cost in Anchorage is about $1,000 per child. And so it looks like we're just about in line with that. Next slide. So this is where it'll be. It's the old NBA, help me, is that right? The old NBA Bank building on Pioneer Avenue. Some of you might remember it. And the borough currently owned it, and we were operating our home health and our functional medicine clinic there. And so we have been scrambling to relocate home health up to the basement of our specialty clinic. We relocated functional medicine up to the hospital. Lots of changes happened to create space for them. Like I got booted out to one of the outbuildings. Like anybody admin just, hit out to duplexes and modulars and everything else. And even our training center where we do all of the clinical trainings for the community and hospital staff, we had to lease a building down at the other end of Pioneer to move them into. So we scrambled to move everybody, and now we're working to renovate the building. This is the childcare grounds. The yellow is the existing building, and all of the red is outdoor space, because the grant is for a licensed childcare center, and licensing comes with tremendously specifically prescribed square footage of outdoor space, indoor space, sleep space, bathroom space for numbers and age groups of who you are caring for. So that it's a lot of outdoor space, but it's good because that's been proven to be what is best for the children. And next slide. This is just a look at now through July. We hope to open in August. That way, as the families begin the school year, it's settled where their children will be. We have to finish renovating the building, build all the outside areas, get the permits, get the kids enrolled, and even do a little fundraising. Even with 1.3 million, we are coming up short for all of the playground equipment and some of the extra details that we'd like to see there. And we have hired a childcare administrator and assistant administrator. That's just one way that it could be done. We're lucky that we have a CEO that was confident and committed to that when the grant came out, said go. And so that was really great, that type of support. He was a CEO at hospital in Wyoming, which did have a child care center, so it wasn't foreign space for him or foreign ground. But it also is part of the commitment to stay open, and the only way to stay open is keep staff, and child care will certainly help us do that.
Good afternoon, everyone. My name is Emily Holloway, and I am the Child Care Director for the Boys and Girls Club of the Kenai Peninsula. I have worked across the board in childcare just shy of 6 years, starting as a teacher's assistant to now director. I have a large passion for this field and feel honored to be in this position today. I received my Early Childhood Development Associates in September 2021, which I renew through the council every 3 years. The Boys and Girls Club of the Kenai Peninsula has proudly been serving families of the community for 36 years, having 7 active clubs, including one in Seward, employing 80 staff members. We are very excited to announce that August 1st, 2024, we will be opening up a licensed childcare center at the upcoming Kenai campus located on South Spruce Street in Kenai. Licensing is a key to quality childcare. It promotes good care by setting basic standards. Before a center or home is granted a childcare license, it must meet health, safety, and program requirements. A child and adult care specialist visits and inspects the facility regularly and investigates all complaints. The goal of licensing is to prevent risk to children. We will be serving a maximum of 50 children from the ages 8 weeks old to 5 years old through the open hours Monday through Friday, 7:30 a.m. to 5:30 p.m. Depending on interest, we are able to offer an early bird add-on from the hours of 6 a.m. to 7:30 a.m. with limited enrollment slots for an additional monthly charge. The Boys and Girls Club of the Kenai Peninsula Child Care Center offers a variety of activities that reflect the needs of the children we serve. We are a play-based center, and special emphasis is placed on activities that develop self-confidence, self-expression, positive social interactions, and self-resilience. Children are treated with warmth and kindness by trained staff, offering support, encouragement, and consistent adult guidance. Kind behavioral management techniques are utilized to protect safety and welfare of the children and others while promoting growth towards responsibility and self-control. There will be 4 separate classrooms in our center. Willow is our infant classroom. This room will hold the ages 8 weeks old to 18 months. For infants, there is no set classroom schedule. We follow the patterns and needs of every child as they settle into the child care space and build nurturing and trusting relationships with their caregivers. Quick response to infants' needs help foster the sense of trust in the world around them, encourage them to explore and envelop at their own pace. Aspen will be our transitional toddler classroom. This room will hold the ages 18 months to 24 months. Toddler years are the time where the child is developing their independence. Your child depends on the consistent routine and confidently explore their environment. The schedule is designed to give ample freedom to be as independent as possible while still providing consistent reassurance and loving care. Play center and teacher-initiated activities involving developmentally appropriate toys and materials will be utilized. Spruce is our preschool classroom. This room will hold the ages 24 months to 36 months. Birch is our pre-kindergarten classroom. This room will hold the ages 3 years to 5 years old. The preschool and pre-kindergarten program gives children ages 3 to 5 opportunities to develop language and social skills through print-rich environment and verbal communication. Activities encourage development of a particular understanding of math through counting, measuring, comparing, manipulative, and block play. Large and small motor muscle skills continue to develop by using puzzles, manipulative, gym, and dojo experiences. Creative senses are encouraged through open-ended art activities, music, movement, and learning about the world around them through field trips, walking excursions, and guest speakers. Our program will include a year-round embedded preschool learning curriculum called Learn and Grow, provided by Thread Child Care Services. We will be promoting healthy development for each child with quiet and active group and individual indoor and outdoor activities. The program includes a minimum of 20 minutes of vigorous physical activity for every 3 hours the child is in our care between 7:30 a.m. and 5:30 p.m. Each age group will have access to our fully fenced-in playground 2 times a day for opportunity to explore age-appropriate outdoor equipment. The children will also have access to a full-sized indoor gym to explore extracurriculars. Safety for all children is our top priority in our center by creating a facility that is free of risks, both indoors and outdoor. We will be hiring on 15 additional staff members for the center, assuring that all required ratios will be met for the number of children in our care. All caregivers in the facility will be properly trained in first aid and CPR for adult, children, and infant. They will stay up to date on the required annual 24 hours of child care training and encouraged to stay up to date on new ways of caregiving. Children are always supervised by adults, and caregivers will always know the whereabouts of all children. High-risk activities will not be allowed and/or encouraged in our facility. Parents' permission is required for any moderate risk activities such as field trips. Electrical outlets will all have child-proof covers in all classrooms for children ages 5 years and younger in our care. All medications, cleaning supplies, poisons such as bleach will be stored properly in locked cabinets and out of reach of all children. Each classroom will have access to an exterior escape emergency door in case of a situation of evacuating the facility. It is a violation of the Boys and Girls Club policy for any person to carry a firearm or dangerous weapon on the facility premises, facility provided transportation, or any event managed by the Boys and Girls Club of the Kenai Peninsula. In 2023, the Boys and Girls Club of the Kenai Peninsula served 67,649 free meals to the youths attending our program. We will be adding a new commercial kitchen to our program that will staff 2 full-time employees. This will allow us to feed the Child Care Center and continue to feed the up-and-coming clubhouses that will be added onto the campus. We will also be accepting the State of Alaska Child Care Assistance Program and are working closely with other entities to provide assistance to families in need. The Boys and Girls Club of the Kenai Peninsula also serves youths ages 5 years old to 18 years old with clubs located in Soldotna, Kenai, Nikiski, Kasilof, and Seward. We are currently taking enrollments for our summer 2024 program and have sign-up flyers here with us today. We are also going to start taking early enrollments for our Child Care Center starting July 1st. So please reach out if you would like to check out the building. For more information on pricing or any other questions for the new Child Care Center or any other Boys and Girls Club related programs, please visit our table right over there, and we would love to communicate with you. Thank you.
Hi, I don't have any slides for you all today. My name is Casie Werner. I am the program director for HYPER, which is Happy Youth Programs and Educational Resources, located in Seward. HYPER was developed in 2019 out of the need for childcare in our community. Seward Prevention Coalition, which is my parent organization that I work for, organized some town halls in our community focused on childcare and launched our first community survey in late 2019. HYPER was created out of these conversations, and the survey results showed a pretty large gap in our need to available childcare slots. So it wasn't a surprise to us that in 2021, the Providence Seward Medical Center Community Health Needs Assessment identified Seward as a childcare desert. In 2021, HYPER was able to work with our local city government to secure some funds that were given to the city of Seward by the Norwegian Cruise Line Fund, and they were designated for economic recovery post-pandemic. And so once we were able to secure some funding, we developed a program called the Childcare Startup Grant, which we support local individuals in our community that want to become a licensed childcare provider. We offer them twice monthly mentorship and partnership meetings with our childcare liaison, as well as $7,500 to get their business up and running. Once they become licensed, they're eligible for another $2,500 to use as a bonus. There's many businesses in our area that do offer bonuses to individuals as a sign-on. And let's see, as of 2024, HYPER was successfully increased licensed childcare capacity by 150% in our community. The first year of implementation, our program expanded childcare by 14
16 full-time slots. We started with 20 full-time slots in 2019. And so by year 2, we had 16 more added for a total of 30 new opportunities for families in our community. We're on track to reach a total of 70 full-time slots by the end of next year. We were able to achieve all of this with an annual budget of approximately $150,000. Hyper initiatives have directly impacted the childcare needs in Seward, reducing the reliance on informal care and babysitting among Seward families. In 2023, Hyper was among 17 Alaskan communities to be awarded the Community Innovation Grant that was spoken about that Homer also received. These funds have allowed Hyper to build out some more robust programming to support our licensed childcare providers and families. We started our retainment incentives and support for educators. It's modeled after June's successful Hearts program. It's an incentive program designed to support and encourage childcare providers to continue on their education and training in their field. We've also launched our family childcare stipend. This provides families with funding to cover the cost of their childcare tuition. The program was created for families on a need base. Families receiving no state assistance receive $200 a month to go towards their tuition cost if their child is attending a licensed program part-time, and $400 a month if their child is attending full-time. I had some parent testimony that was provided to me shortly, about a week ago, and there was one family, due to this family stipend, they were able to use the additional funds that they were saving from paying their tuition to get a safer vehicle to attend work and get their kids to school and childcare. We had another family who was able to pick up more work, some more shifts at her employment. And so we've seen a pretty positive impact from that program, which is really exciting. We're also providing quarterly provider networking meetings, similar to what Cynthia had mentioned doing in Homer. This provides a space for our providers to come together, collaborate, and build a sense of community, as well as become aware of any supports that are out there within the state, our region, and our local community. So we're going to continue to address the need of childcare and build upon these programs for our local childcare.